Okay, welcome everybody to the next of our video webinars with specifically for families in the Alachua County Digital Academy option. So today we have a lot of great information to get at you. Dr. Jennifer Sager has been kind enough to share her expertise with us. She is a licensed clinical psychologist at the ITM group in Gainesville, Florida. She's presented nationally. She's published quite a bit on diversity issues. And in addition to doing therapy, she also conducts expert witness testimonies, and she's created training workshops on how to keep children safe from sexual abuse. And in addition to all of those wonderful things, she's also a mom of children in the Digital Academy as well. So she's bringing a lot of expertise and perspectives to our talk today. So as we speak, if you would please, if you have any questions, put them in the YouTube chat, and we will, both Amanda Pezzett and Michelle Snyder-Smith, who are our co-admins, will get them to us, and we will get them answered as best we can. So with that, I'm going to turn it over to Dr. Sager.
Thank you so very much. So I'm very, very happy to be here. I definitely want to say that this is a really important topic. School is our primary provider of mental health resources. It's our main access point for diagnosis and treatment. So I'm really hoping that today you leave with some actual clear tools that you can use with your kids and also for yourself. So I have a PowerPoint. I'm going to start sharing my screen right here. So hopefully this is all working. And let's see. That look viewable to you? Fantastic. All right. So again, we're talking about mental health in digital learning. And so this is specifically for Digital Academy, but it is broad-based for anyone in digital learning. And there's going to be a lot of general mental health stuff that we're going to go over. And so there we go. Here's our agenda. So we're going to go over a bunch of different stuff. I'm used to talking pretty fast, so there's a lot of information. We're going to hit definitely some suggestions. We're going to go over how to talk to your kids, mental health warning signs specifically by age, because it is going to be different, you know, how you're going to be rubbing off on your kids, and some of the good things that we've learned probably from being in for 5 months. So first thing, we need a reality check. Lower your expectations, all right? Seriously, we are not going to be winning at this at all, okay? So if you're looking at stuff and you've seen like the things like so-and-so wrote this symphony when they were like stuck in the house. Yeah, that's not us. So what you're seeing, this lovely little triangle here, this ends up being Maslow's hierarchy of needs, right? So the idea is that you have down here your basic needs. These are your physiological needs: food, water, shelter, safety needs, you know, security. This is where we are. Maybe some of you have moved up to here, belonging and love needs. And I think that's probably where a lot of people are feeling the pinch. They're wanting to be close to people. They're wanting to hang out, because if you've taken care of your first 2 lower levels, then this is the next one. But it's really important to notice we're not here. We're absolutely not going to be at self-actualization. I'm doing fabulous stuff and I'm lighting the world on fire. So if you had the expectation that your kids were going to be amazing this year, here's your reality check. It's not exactly going to happen. All right. I need to like clear all my stuff. Also remember that not all of us are living in the same pandemic. We're not all having the same experience. We all started at different points and we all have different resources. So you may have friends that are doing better and you probably have friends that are doing worse. So this is a wonderful time to practice some grace and understanding and being kind. And most important, take care of yourself. You need to handle your own stress. I know that, again, this is focused really specifically on your kids. You're going to need to focus on you so that you can help everyone else in the house. So we're going to hit, the first thing we're going to do is going over personality traits. There's going to be a lot of questions about my specific kid, how my kid is going to handle this. And I think it's important to have a basis for understanding there are 5 solid personality traits. There's the tendency to seek out others. That's your introversion, extroversion. trusting and helpful. Some people are more agreeable than others. Tendency to be organized and dependable, right? So there are going to be some kids who just can organize their time, and that's a personality trait, not being lazy. Another one is how we respond to psychological stress. Some kids are going to be great with it, and some are going to have a much more difficult time. Again, this is definitely going to be about personality. So if your child is having a hard time with some of the digital learning, I want you to think back a couple of years. How do they normally respond to psychological stress? Is this new, or is this some of the same things that they've been doing? And your last 5 for the big traits is your degree of intellectual curiosity and how much they need something new. We're going to go into a little bit more detail. You can kind of see for extroversion, if you're low on it, that's going to be your quiet, passive, reserved child. And so they're not going to want to talk on screen. It's just who they are. And then if they're high on extroversion, they are going to be talkative and active, and they're going to want to move. They may have difficulty sitting in the seat. When they're done with their 6 to 7 hours of being on Digital Academy, they're going to want to tell you about their day, even though you may be exhausted, right? Again, it's a personality trait. How agreeable. Some people are just more suspicious and critical, and others are more trusting and soft-hearted. Again, this conscientious one is going to come, I'm going to hear that a lot with people, like, how can I organize my kid? Part of it is recognizing where they are as a starting point. Some are just going to be more organized. Again, that how are you handling stress? Some are very calm or unemotional, and others are going to be more temperamental, and you're going to see their worry. And it's really start to pay attention. How have they always been in their life? And are you seeing a change now that they're in Digital Academy? And then their openness. Some are very down to earth, but that also means that they're not very curious, and others definitely need new and interesting things, and they may be very bored while sitting in front of a computer, and you're going to want to help them find creative things outside of the class. So what's super critical is recognizing that you have to match your temperament to them. So you can imagine if you have a kid who's really talkative and really trusting, and they're disorganized just naturally, and they're really calm, and they're curious, but you tend to be really quiet. You're trusting. You're super organized. You do tend to worry. That's just how you are. And you're curious. You can see, you can almost line up and be like, oh, my very talkative kid is going to really drain me, because as soon as they're done, they're going to want to tell me. You're really well organized, and maybe hard for you to understand how they're not organized. Again, it's a personality trait. It's not about being lazy. You may actually be more worried than your child. These are just different traits. You want to try to match as best you can, and then have some grace and be kind. All right. And so again, when you're having some conflict, stop, pause, and think, is this a result of personality difference? Because that's going to be a lot of this. We're going to move on to suggestions for stability. All right. How to stay sane during this. Structure and routine. This is going to be your most important thing. I think probably there's like 6 slides. You can all count and keep track. Structure and routine is critical. We, as adults, as parents, the kids, everybody, if you have pets, they like predictable rules. They like consequences, consistency, and the expectation. And the reality is that behavior problems are going to increase when we do not have a lack of routine. And that's even with us. Like, even as adults, we notice that we fall out of our own routine, and then maybe we're not being so healthy. Maybe we're not eating as well. We're not exercising. Maybe we're cranky. So we need a routine as well. Best practices. If there's anything that you pay attention to, it's going to be this. These are our best practices. So we have a routine. You want to make sure with your kids that they have a sleep-wake cycle that is pretty much the same every day. On the weekend, it can probably slide an hour or 2, but not much more. It is not helpful if they're up every morning at 7 or 8, and then they're sleeping till noon on Saturday. Then it's going to mess them up. So you want to have a nice sleep-wake cycle. All of your kids are going to need 9 hours. They'll need 9 hours, honestly, till they're about 20. So 9 is really what you're shooting for. Probably over the summer, most of our kids have totally messed up their sleep cycle. I know mine have. So it's just one of those things. Now's the time to start getting back into it. Hygiene. We forget how important this is. And kids and adults, we shame ourselves like, oh, I should know this. This is absolutely how I should be. But the reality is that this hygiene is critical for mental health. Showering, brushing your teeth, washing your face, getting dressed. I don't care if you get in new pajamas, but just change out of whatever you were in. That's fine. But hygiene is super important. So one of the things that in general life, when people stop showering, they stop brushing their teeth, they stop the basic hygiene, it's a sign that mental health is starting to slide. With most of your kids, it's probably just summer and they're just not being aware of it, but this is a good time to make sure that they're in it. You can imagine that if someone's really like rocking classes and they're doing well and they're handling things, but they're not showering at all and they haven't brushed their teeth in 2 days, they're probably not doing so well anyway. It just goes hand in hand. Okay. Outside, you want to be outside. If you're having a child who does not like to wake up early in the morning, or yourself, sunlight tends to wake us up. It resets our circadian rhythm. You want to have some fresh air. You know, we're trying to not do as much screen time. If your child is on their phone, you may be like, okay, go outside. You can be on the phone, you can be on the switch, but I need you outside. There needs to be fresh air. Exercise. With the younger kids, do a dance party, teach them yoga, ride your bikes. You want some physical activity. They used to be walking at least back and forth from class. Now they're not. I put like, during the summer, I put like my Fitbit like on my kid and she ended up doing 300 steps a day. Okay, we need to move. Everybody needs to move because it helps. Next up is hydrating. Really easy to forget, and we live in Florida, and it is important to really be packing away that water and make sure that there is healthy food available. For a lot of us in our kids with Digital Academy, they're during a 5-minute break, they're going to run to the fridge, and you need to make sure that there is available snacks that are healthy for them. Otherwise, they're just going to go to the pantry and get cookies and crackers. We're going to talk about a self-regulation box, to face, or an actual phone hearing a voice. So the more real, the more connection you get, the better. And then age appropriate news, right? So it's really easy for kids to walk in if you're talking about the news and you're really stressed about it, but you want to make sure that you give them age appropriate news, and you want to balance it with some good news so that they have it. New skills for you to learn is breathing, right? So here's the thing. Anxiety is linked directly to breath. Once we're upset and we're anxious, you have to fix breath. You cannot say to your kids, calm down and it's going to work. They don't know how to do it. Even adults don't know how to do it. You actually need to then start fixing breath. Once you're anxious, it's in your body. You're having a body reaction. You cannot unthink it. You can do something in your body to fix it and help it. So we're going to do this. So everyone, I know it's silly because it's YouTube, but that's how this goes. We're going to breathe in. I want you to do birthday breathing. So for younger kids, and even sometimes older, you breathe in and you're going to blow out hard birthday candles. Breathe in, out. I know some of you watching this YouTube video didn't do it. Okay, so seriously, let's do this again. Breathe in and out hard. That's the way you want to do it. You can even feel, if you did it, I hope you did, your body starts to relax as you're breathing. If you're having a child or even yourself, you're starting to, the worry is so much that you're short of breath and you can't calm down. Like, you see that kind of movement. Now what's happened is there's too much carbon dioxide coming in, or rather like it's stuck in and you're not getting it out fast enough. All right, and so now there's an imbalance and your system's starting to freak out because it's not getting enough oxygen, it's holding the carbon dioxide in. So then you need to do what's called metered breathing. So again, we're going to practice that. The idea is to breathe in to a count of 4 and out a count of 7. If you have asthma, you can do a 4-6. You can do a 4-5. You can do a 5-7. I don't really care. But it has to just be a little bit longer on the way out. So again, we're going to practice this. All right. So we're going to breathe in, and I'm going to do it. And so everybody breathe in. Out. In. Out. You do that for a solid minute. And as you do it, you slow down the count. So you might start with 1, 2, 3, 4. But then at the end of the minute, you're going 1, 2, 3, 4. So this is how, and you're going to want to count this for your kids. You're going to actually want to help breathe in on a count of 4, breathe out. For them, they may need 4 and 6. Whatever works, it's just whatever works. But if you practiced and you did this, you didn't let me be all silly by myself, you probably would have noticed that your chest actually started to relax a little bit. All right. Repetitive motions. So left and right movement is really important. I ended up doing my master's program while I was right after the Oklahoma City bombing, and they needed to do crisis intervention with large groups of kids because of it. And so one of the things they did is this left-right movement butterfly kisses. It's just this. But for younger kids, it's really great. It just helps them like breathe and process stuff. Jump rope, walking, drumming, anything that has a repetitive left-right movement can be really helpful. With younger kids also, there's this thing called magic mustache. So right here, there's like a kind of a pressure point. And so when you touch right here, it kind of calms you down. And so what you'll do with little kids is you'll be like, magic mustache. And they're pushing on it. And it really can actually help calm them down. Okay, so I'm like checking my time. I'm behind. We're going to talk fast. All right, so the next thing is going to be your self-care toolkit. This can be a shoe box or a larger box or whatever you want, and actually let the child decorate it. If they're older, you kind of can just talk to them about maybe having some things. Again, so it's your basic 5, and then you're going to add movement and comfortable pressure. Obviously, you're not going to be putting a rocking chair in the shoebox, but you could also put like a piece of paper that says rocking chair so they remember, oh yeah, I should go there. Because when we're anxious and we're sad, we don't remember stuff. That's the thing. When you're depressed or you're anxious, you can't make decisions. So it's super lovely to have an actual kit where you're like, oh, that's right. Here are the things that I like. Let me go get a blanket. Let me go get a weighted blanket. That's going to be your pressure. Let me do some watercoloring, things like that. I want to talk a little bit about smell. Smell is super special. Here's why. All the other senses are housed, in the same general area, except for smell. Your olfactory is housed in the amygdala. So the amygdala is what's linked to emotional memory, which means it's incredibly powerful. So smell out of everything can really switch someone's mood. Since we live in Florida, I always recommend one of the 4. You talk with your kid, figure one out. Citrus, vanilla, lavender, and coconut, right? Because coconut ends up being in like all of our suntan lotion. The thing is though, with all 4 of them, you can double up on a scent by making sure you can get it in a food, right? Citrus, lavender cookies, vanilla, and even coconut, right? So these are some of the things you can double up with taste, which is nice. But for smell, you can have lotion that they can smell during it, and then you are also doubling up on the touch because now they're using it as a lotion or like a chapstick. So smells really a fabulous one. Another one is ice pack. If you have a kid who ends up being very dysregulated, and this skews even for your teens, like they really like the breathing, nothing's really working, ice packs can help. Not that you're shoving it down their shirt in any way, but you have them hold it so that they can kind of breathe, and they may then allow them to be in control of their body, like put it on themselves. Cold, definitely handles anxiety. It resets your system. It's a shock. And then the last one, which is super nice, is a singing bowl. And so I brought mine in. And so these are lovely. The problem, of course, with Zoom and YouTube is you're not going to hear the sound very well. So I'm just going to try. But it's a lovely bell, right? And has a nice little chime. You can roll it around and then it gets this very loud sound. But what's lovely is you let the child do it. And they have to sit and they try to make the other sounds with it that are soothing. And so that ends up being very nice for some quick audio, and that's something that can happen. They can use their self-care toolkit in between classes. The next part's gonna be how do you connect, all right? So you wanna really focus on connecting over achievement. Give each other the benefit of the doubt. This is gonna be stressful for everyone. This is brand new. And so if your kid's having a hard day, they're just having a hard day. If you're moody, you're just being moody. It's okay. You want to expect that there's going to be behavioral issues. There will be more worry. There will be some nightmares. There's going to be difficulty sleeping. They're going to test the limits. There will be meltdowns. And there might also be adult meltdowns, so be kind to your friends and partners and stuff. But in general, there's going to be a lot of testing of limits, and this is where you want to be kind. This is not the time to add new dramatic consequences. You want to focus on emotional connection. So, although I'm saying let's focus on emotional connection, how do we do that? And although some of you may have an amazing close connection with your kids, there's always ways to improve it. We're going to go over what's something specifically from Lynch's work for radically open DBT. And the idea of this is it's the opposite of defensive arousal and resistance. And you can imagine as a parent, if your child is being resistant or difficult or not wanting to go to class or refusing to get out of bed or whatever it is, you're going to get irritated. I know I get irritated. We all get irritated. That's just what happens. And so, but being radically open is realizing we don't know everything. Maybe I don't know exactly what's going on. And since I don't know everything, I'm going to make a mistake. And two, to learn and get better at it, we're going to have to attend to what we don't know. So the idea is being radically open. It's not radical acceptance. It's radically open to learning and listening and connecting. And a huge piece about what I'm going to teach you is how to physically relax as an adult so that then you're demonstrating to your child that you are actually really open. Because let's be clear, there are a lot of times we have that pinched face and we're like, why are you doing this? And we look all irritated. They're not telling you. You have smart kids. You're mad. They're not telling you. It's not going to happen. So it is important for you to socially signal that you are open and really willing to work with them. So we're going to go through. Plus one is going to be lean back in your chair. So go ahead again. Lean back. There you go. I know you really want to be up close, but everybody lean back. The reason this one is a plus one is because you're not always in a chair when you do this. If you're standing, that doesn't really work. So that's why this gets to be your plus one. Your first one is a slow, deep breath. So this is where you may need to be doing the metered breathing or the birthday breathing. And you breathe in and out. Breathe in and out. And it's okay to do this in front of your kids because it's not like magic that we're suddenly calm all the time. They need to learn these skills too. So it's okay to say to them, oh, I need a minute. Okay, now I'm ready. Right? So the slow, deep breath. 2, you want to have a closed mouth smile. All right, all of us know there are enough times people will smile and it's totally fake. I'm so happy to be here. Okay, that does not cause a close connection. A fake smile causes people to walk away from you. Like they don't trust. You have to actually smile enough that the lips stretch across your teeth. Like it can't be like, it has to like, you have to really try for it. Sometimes it's gonna be so much that it crinkles. But in general, that closed mouth smile is going to let your child know you are in a place to listen where you're ready to be open. Your third one, this is the super fun one, is the eyebrow wag. All right, so you know what this is. You know the eyebrow wag. It's a wag. And everybody, I bet all of you laughed just a little bit or chuckled, just a teeny bit. Because it's an eyebrow wag. It signals I'm ready to joke. I'm ready to listen. I'm ready to have fun with you. So you're in a safety place. Now, if your child's talking about something serious, the eyebrow wag's going to look weird. But in general, using your eyebrows and moving them signal to somebody, I'm ready to connect. Here's the fun one. We call this the big 3+1. Here's the lovely thing about this. It's bi-directional. So if you started with yourself being stressed, and you do these, it actually causes you to calm down. What these things do, especially the eyebrow wag, is it activates a ventral vagal complex. So that's in your parasympathetic nervous system. That's the one for relaxation, where it actually calms you down. So it's bi-directional. When we're naturally calm, we naturally do all these things. When we're in a calm place, we naturally lean back. We naturally have slow breathing. We naturally smile, we use our eyebrows, but if you can do these things, it also forces you into a relaxed place. So start here when you're needing to connect with your kids. Next one is going to be learned optimism. I'm checking my time. Okay. So you're going to have kids that are going to engage, especially your middle school and your high schoolers are going to engage in this negative self-talk. There are probably times you're also engaging in the negative self-talk. We all do. So I want to go over exactly how to stop it, because it can be really dangerous for our self-esteem. So this comes out of the book Learned Optimism, but it's Seligman's work out of the University of Pennsylvania. And so here's what people do for negative stuff. Pessimists, when things go wrong, it's permanent. Oh, I'm never going to understand this. I'm never going to get it, right? It's permanent and it's universal. Oh, I suck at math. I suck at all math, every math, even 1 + 1, all math. I can't do all math. And then you internalize it, right? Like, it's my fault that I suck. Permanent. Okay, it's always going to suck at math, at every different part of it, and it's my fault. And that's what pessimists do. Optimists do the opposite. This is hard right now. Digital Academy is hard. It's very specific. The specific class is very, very hard, right? And you externalize it. You know, this is not just me. There's other things going on and why I'm having a difficult time. This is going to be super critical because your kids may end up really engaging in some negative self-talk. You're going to want to make sure that they understand, actually, this is temporary. It's very specific. And let's externalize it. Sometimes this is just the situation that it's electronic virtual learning and it's new. Here's the other fun part. Positive stuff, we reverse. So pessimists, let me pull up my little thing. Pessimists come over here when they end up basically being, when something good happens. Oh, it worked out really well, but that's not going to last forever. And then pessimists are like, oh yeah, I won that one little thing, but it's just that one quiz. And oh, I did well because the teacher made it really easy. Okay, so they kind of pee on their successes. And then your optimists, when they do well, it's permanent. That's right. I am smart. I'm gonna be smart forever, and I'm gonna be smart in probably all my classes, and it's totally because of me, right? So it's not at that level of narcissism. It's just, this is how they make sense of it. So this whole situation starts to be really critical. And we call these the 3 Ps because it's permanence, pervasiveness, and personal. So those are the things. So it's important for you to check your own negative self-talk, and then nicely, you being very open, correct some of your kids and be like, actually, here's the thing, you know, basically you're practicing, hey, you sat for 2 hours. That's a really big thing. I'm really excited. That was, you know, you're working really hard, all of those things. So you kind of pay attention to that self-talk. We're going to move on to different ages, mental health for the ages. All right. So 4 to 7. All right. They're going to stress, and you're going to see it by they're going to have some regression. And they're probably going to have some separation anxiety. And we're going to hope that it's going to be temporary. As soon as you put them on a routine with a schedule, it should start to take care of itself. It may not be your pre-COVID-19 schedule because that may have been really too rigid. You may be expecting too much. So think about what are your core basics for a schedule. And then any new schedule, you want to have age-appropriate explanations, why things are suddenly different, so that they understand this is different. We may go back to the other things later, but right now we're doing this. And then definitely be using that sensory toolkit. 7 to 10. So they're going to pick up on your personal stress. They're going to be afraid of them getting sick, of you getting sick, and of grandparents and extended family. Again, remember I said earlier, hydrate. So please understand, 7 to 10, they're not very good at expressing their emotion. They're still learning how to express their emotion. They're not going to be able to say, well, I'm worried about this. They'll just say it a little bit, and you may not be able to get all of the depth of what they're really feeling because they don't even know exactly what they're feeling. So when they have few emotional outlets, they're going to have a fight or flight response. And usually it's important to understand that flight is your first response. That's all humans is flight. They're wanting to get away. So if they've moved to fight, it's because they feel trapped. It feels like you have to sit at dinner, you have to sit here, you have to be on Digital Academy. And it's important for them to understand if you're starting to melt down, walk away from the computer. Your mental health is going to be more important. And it's better for you to take 5 minutes away from the computer and breathe and take care of yourself so that then you can come back. Because if you sit there and you get more and more stressed and then you're fighting, you're probably not coming back for the rest of the day. So again, it's one of those things where you're needing to really value mental health during this time. Use the relaxation techniques. Teach them some of the relaxation techniques. Teach them the deep breathing. There's another thing for progressive muscle relaxation. Honestly, if you Google it, it'll be really easy to find on YouTube. It's the idea of like you squeeze like different parts of your muscle groups and you hold it. And the idea is then it overwhelms the muscle so that then it goes actually back down to baseline. And it's very nice. And you want to have them practice it. So if you have a very physical kid who's like, seriously, this breathing thing's not working for me, use the progressive muscle relaxation. Physical activity, biking, walking, dancing, any of these things are really going to be important to maintain mental health, in addition to those best practices earlier on. 10 to 13. So your middle school, oh, they are really going to feel it. They're going to have the worst time with the academics because middle school is stressful. The workload gets harder. They're going to have a lot, and they may not have the same amount of guidance that they really need. So even kids that are really motivated, and you got to understand that they don't always know how to self-direct. They are not going to know how to manage their time. They just won't. So it is important to be able to sit down with them and go, okay, tell me everything you have. Like, let's come up with a schedule, what makes sense. It may be one of those things where you're needing to also advocate for them, where you're like, look, after 6 hours sitting in front of a computer, my kid can't like do this long assignment. They're just done. They'll be able to turn it in at the end of the week, but there's no way they're doing it with 1 day's notice because it's just hard. So you may have to advocate for them. They may have lower grades. They may have fights. They don't want to log in. These are some of the things. So in response, to help them, again, structure, routine, realistic expectations. Spend the time acknowledging what they've done, not achievement, right? You sat all day. I'm so proud of you. I don't want to sit for 6 hours in front of a computer. Like, that's amazing. You sat for an additional hour doing schoolwork. That's fantastic. Again, you're praising the effort and the time. Really, middle school, check in on that sleep hygiene. It's going to be really important to make sure that they are waking up and going to bed on time. Middle school also tends to start taking forever. Like, suddenly, like, the showers take longer and the brushing the teeth takes longer and like washing the face. And so you're like, why is it taking you 40 minutes to get ready for bed? But it does. So you have to then use the elapsed time that they made you learn in 3rd grade, where you're like, okay, if I need you in bed by this time, you're going to have to start like at 9:30. Start doing some fun things with them. They still like hanging out with you. Walk or bike, virtual yoga class, maybe do a martial arts class, guided meditation. Like, spend time with them and teach them how to relax. Like, they don't know how to breathe. Teach them to recognize when they need to walk away from the computer, when they need to walk away from their homework. Woo, I am overstimulated. I need 5 minutes. Sounds good. Go take care of yourself. They won't know, and they're going to end up being overwhelmed, and then they'll fight because they don't think that they can lead. So give them permission. Now your teens. Okay, so they know how to study. They know how to do school. They know academics. For them, it's the social distancing. It's just going to be harder on them. And so this is where you're going to see like some of the early like sadness, lack of motivation, and they're having huge loss. Like, for some of them, they're like, am I going to get to go to prom? Am I going to have college visits? Are we having like this performance? Any of your kids, like, are we doing any of the celebrations? So they're going to respond with irritability. They may be sleeping all the time and then staying up super late at night. They may end up like breaking the rules so they can hang out with their friends. And so they're feeling really hopeless and helpless. So with them, what makes it hard, and this is where you want to be patient, they should be pulling away from you. Like, that's the natural stage. They should be independent and doing things, except now they're trapped at home with you. And they're like, oh, you're like, this is when they're supposed to be pulling away. So the whole issue for them is it goes against their natural development. And again, you're wanting to be very kind and understanding. The hard ones are watch for the withdrawing behavior. Like, they're isolating, a total breakdown in routine. You want to really want to help them have meaningful ways to connect with friends at a safe way. Let them play the video games, have them sign on together, have them cook, the same recipe with a friend, or have them eat dinner, not with you, but like have a dinner with your friend group and stuff like that. Maybe they can, from a distance, like do a visit or a bike ride even, have them physically go on a walk while they're on the phone so that they also get outside and they get some privacy so that you're not eavesdropping on their phone call as well. All right, so we've got a bunch of different warning signs to think about. There's a lot of anxiousness. So when you start to hit some of these are when you're like, oh, I might need some extra help, okay? When you start to see these things, you may need to call a guidance counselor. You may need to call the pediatrician to kind of see how they're doing. You may want to call a therapist. So really extreme mood changes. And we're talking extreme, not the stuff that we were talking about that, oh, this makes sense, you're having a hard time, but more extreme. Very severe changes in sleeping and eating habits that don't adjust when you're starting to set a routine, so that they're just continuing. You're seeing body image disruption, feelings of hopelessness, worthless. They're excessively crying, excessive irritation. Again, these things are going to be continuing after a couple of weeks when you have already set a routine and you're already connecting with them and you're already challenging some of the negative self-talk. All the things early on are basically to avoid getting on this slide. Okay, that's the idea. Let's say they're having difficulties paying attention, and we're talking really high forgetfulness where they're like, what? I totally forgot we had class today. Really severe. Maybe there's some paranoia and there's some suspicion. That ends up being a big deal. High fatigue, high reduced energy. You end up having some acting out behavior in teens where you're like, whoa, what's up with that? Maybe they're even like your middle schoolers return to like thumb sucking, where you're like, what's going on? Okay. And again, withdrawing, and we're talking total withdrawal. Not like, oh, I just want to hang out in my room, but like, nope, I don't want to talk to anyone. I don't care about anyone. It doesn't really matter. And especially this one, they avoid activities they used to love. Nope, I don't need to play Xbox. What? What do you mean? Nope, I don't really care. Nope, I don't want to read anymore. Things that they loved, those are big warning signs. And of course, the obvious ones are going to be self-harm or harming others. If you're noticing like an abuse of drugs, you notice like, oh, why is there like cough syrup being gone? Things that are in the house start to be abused, and expressing suicidal thoughts and intent absolutely need to be taken seriously. So emotional contagion. This is one of those things where you have to take care of you, because how you are feeling and what you are doing will totally rub off on them. All right, so for yourself, again, set a routine. Stay connected to your adult friends. You may need to be eating with them and hanging out with them. You need fresh air. You need more daylight. You have to sit outside. And again, you're setting a good model for them. Make sure that you're exercising so you're taking care of yourself. Handle your own sleep hygiene. I know that we're going to be definitely burning the candle from both ends because we've got our own work, and then we're also trying to handle Digital Academy. You have to make sure that you're rested. Be aware of mindful eating. One of the things, you don't want to just keep shoving food and not paying attention. Slow down a bit. As an adult, please don't doom surf. Don't like late at night, like start scrolling and being like, oh, look at all the horrible stuff. You're trying to slow down for the night. You're trying to calm down for the night. Don't doom surf. It's not very helpful. It's just going to make you feel more disconnected. And remember, early on I said art. You may need to be doing some art. So don't just set up art for your kids. You need to also be doing some of the art, all right, so that you're doing something creative. And you may need teletherapy as well if you need some support, right? Recognize when you're at your limit and you notice you're on edge all the time, you're really snippy. The idea of trying to be open and calming down to like talk to your kids is just overwhelming you. These are your warning signs also. Here's some things that we've learned, right? So we as humans all need to connect. And texting and all of the visual electronic contact that we were doing in January, we were all disconnected. So because now all of us are like, gosh, I just really want to like hang out. I'm sure all of you were like, oh, I cannot wait when we get to see each other because I'm going to give lots of hugs and it's going to be really, really awkward. So we have all learned that as nice as texting and email is, it's not a substitute. We've also learned that most of us were already overwhelmed before March happened, and most of our kids really need to learn better coping skills. We might have just been going through the motions, and this whole experience has been a stress test where we realize, yeah, I probably need to teach my kids coping skills. And we as adults probably need a refresher about our own coping skills. And so these are some things that we probably have all learned in the last 5 months. Um, Routine decreases anxiety from all of these unfamiliar experiences. And of course, please, we need to know that resilience and flexibility and the restraint where you're like, oh, I can't go out or I can't do this thing, all of those things are more critical than good grades. Okay, the mental health and everything is more important than good grades because their grades will be okay. Please know everyone in the United States is struggling with this. Whether your kid goes brick or mortar or they're digital academy or they're just doing homeschooling, everyone in the United States is going to have a difficult time. And again, going back to that first slide, no one's winning at this. But what's going to be helpful is if your kids come out of it and you come out of it in a safer emotional space. And that's my last slide. So I'm going to stop my screen share.
Wow, Jennifer, so much awesome information. You know, I was thinking it's kind of like two levels, right? It's the level of the whole family, and then it's the individual with each particular child, right? So one of the first questions that I have is, what do you do when multiple children require vastly different interventions? And of course, you know, they're watching and they're paying attention, and then comes the, well, so and so, and how come he gets to watch TV to decompress and I don't? You know, had suggestions about that?
So I think some of it's going to depend on the ages, right? Your older kids, you can honestly pull them aside and be like, look, at some point in college, you're probably going to take like a basic psych class. So we're going to go over those big 5 personality traits because you're going to learn them. Here's why. Here's why we're doing things differently. And, you know, we're just different. And I think sometimes the easiest way is like, look, some of us are extroverted, some of us are introverted. So-and-so wants to talk a lot. So-and-so needs more space. There are just some differences. And I think in general, explaining and being really explicit with kids, be like, we're all going to need to work on our coping skills. And you can announce it. So if you're like, hey, I'm overstimulated today, so I need to read. I need an actual physical book, and I need 20 minutes because I'm overstimulated. And then I can actually attend to you. Unless something's on fire. We all good? Because I'm going to go sit. So then you're letting people know, ooh, okay, mom's like hit a limit and she's just going to go take care of herself, which is modeling how to handle it and reminding. Then you're starting to use those language like why so-and-so gets to play the video game because that actually calms so-and-so down. It makes you cranky. So no, you if you end up basically like doing this for like an hour, you're really mean to me. So it just does something different to you. You can do it for a little bit, but you have to do 20 minutes of actual reading because that calms you down. Then you can play. So I think some of it, and you're going to have to modify it. High school is going to be different than middle school versus younger.
You know, it seems like a transformative piece is naming the intentionality of what you're doing for you as a reminder, I think, for us, but also to just kind of communicate so that it doesn't maybe feel as arbitrary.
Yes.
Yeah.
I think it's always a really good thing because, again, with everyone in the house, you're needing to explain and teach coping skills, and you're not wanting everyone to mind read. We all like to pretend, oh, mind reading. Look, you just know. No, you know what that also means? That means you're disrespectful and you're not listening to me when I say I have a limit. Mind reading's not a good thing. Let me tell you, and then listen to me. And then you're also wanting to teach your kids how to say, I've hit my limit. They may need to say that to their teacher. There may be a point where, they, in a chat, private message their teacher, and they're like, I'm feeling overstimulated. I'm turning off my video. I'm still here. Okay, that's how this goes. They have to be able to know where their limits are so that they can start advocating for themselves, and they got to tell you so you help them.
Mm-hmm. That's really important. In the same way that we would teach them and model with them to advocate in a brick and mortar setting, we have to remember that they can do the same in a digital academy setting. We have some control.
Absolutely.
It's really important.
Yes.
So I'm going to read this one word for word because it's important.
Okay.
The sensory taste. Is this why I am finding food hidden in my son's room? And I can't get an answer on why it's in there other than he is hungry in the middle of the night, but we let them eat whatever whenever. We make sure he is full before going to bed, even if feeding therapy dinner. He has sensory processing, PTSD, Asperger's. Could he be looking for his sensory taste?
Most likely. So that is a really specific question. You definitely have, like, that particular child has some special issues going on already. Food is always a safety thing also. All right. Food just is a safety thing. So part of it is to discuss one of the things, and I'm not sure the age. Should it say the age of the child?
Didn't say.
Okay. So we're just going to go with it. Part of it is, let's tease out some of the pieces, right? There's food in the room, and you're eating late at night, but you're leaving a mess. So maybe you break it down. You're like, hey, let's start. The thing that bothers me the most is you're leaving the food in your room. And we live in Florida and there are bugs. So I need you to not have the food in your room. I'm going to put a garbage can in your room with a lid. I need you to put the food in there. And then I need you in the morning, or every 2 days, you got to take it out. So that way you move it to responsibility. You move it towards, you have some freedom, and then see what happens. If you're getting resistance just at putting it in a garbage can, then you need to have a discussion. What is this about? But once there ends up being this combination of, all right, we're giving you some freedom, but here's this other piece of responsibility, they may be able to adjust, and they may then feel safe enough telling you exactly what it's about. Because in that one may be some of the sensory taste stuff, but it may also be that there's a safety thing. Before that child goes to bed, I might also introduce the idea of like tea and flavored tea that doesn't have caffeine, and see if the child would be interested, and then you work that in to the ritual of bedtime. And maybe like a teeny tiny snack that's more healthy, like, hey, would you like to sit? We'll have some tea. We'll have like a little tiny snack before you go to bed. And now it's a ritual rather than a sneaking thing. So those are just some ideas.
Yeah. I like how in all your approaches, it's not let's go straight down the middle and steam barrel through it, but it's let's find a way to redirect the energy from antagonism or resistance into cooperating. That's really cool. Here's another one. Any tips for helping an ADHD kiddo going into Digital Academy Middle School? I also struggle, so I'm worried about helping him manage the new environment and the increased workloads.
Right. So
that's a tough one.
It is hard. So here's the interesting thing. I think some of it is explaining, again, I'm not sure the age, but some of it is to explain like, hey, this is brand new for me. I don't know how this is going to go. So we're going to talk a lot on day one and you're going to tell me. Or maybe on day one, you kind of say, here's the thing, I'm going to sit off to the side and you're not going to wear your headphones because I need to hear what's going on so that I can maybe figure out after school ends what's going to be the best plan for us. The fun thing, though, that I think is going to be good for your ADHD kids is they can do a ton of stuff off screen that's helpful. That's not going to be distracting. I'm sure I have. Like, they can have their, like, all of their, the fidget cube, not a spinner. Those things, those are really distracting. But this off to the screen. They can have it off to the screen and stuff like that. They often need to have some movement. So they can like be fidgety as much as they want and move, things like that. You can get the band to go under their chair. You probably want to make sure that they don't have a swivel chair because that will make the teacher and anyone on the video crazy. Swiveling, so you don't want to do that. So you might be like, you need a solid chair just out of ease and stuff like that. So those are some things to do, and be like, we're just going to have to figure it out.
Okay.
But it's hard. And have some grace for yourself. And basically, I do think, and this goes across with every kid, be like, look, we don't know what this is going to be. So we're going to do our best week 1, and we're all going to talk on the weekend, and we're going to come up then with the next plan, and we will figure it out.
Okay, that makes a lot of sense. And I like that we're doing it together aspect of that.
Yep.
Here's another one. What kind of strategies do you recommend for children who are shy on video calls? I'd like to also add on to this one when the child is normally not shy.
Okay. All right. So this is one of those things where it's important to help them understand that everybody looks kind of silly on video. We just do. And this will be one of those things that hopefully teachers are going to be doing things that help modify it. So teachers will probably do things like set it up where they're pinning their video so their video is really big and you're not noticing all of the other people. Or there is a way to hide your own screen. And that may be one of those things for the child to be like, look, let me show you how to hide your own screen so you're not distracted. And if it continues to be an issue, then you may need to advocate and talk with the teacher and be like, look, my kid is just so distracted by her own video, and that the fact that she's on video. So what I need her to be able to pay attention for the first week or for the next week. She's going to basically keep her video on for the first couple minutes, and then she's going to turn it off. Then she's physically there. I will make sure she's physically there. And I'll have her the last 5 minutes turn it on or something like that. And let's just let her adjust, and then we'll see where we are next week. So you don't promise the child you don't ever have to do that. But you're like, let's just do it for a couple of days and see how it goes. That's one of those things. Again, I think all of us are going to need to be flexible, and your teachers are trying and doing so many amazing things. They're not wanting to make this difficult. They're wanting to work with you. So saying, look, it's really awkward this first week. We're going to do this first week. I hope you understand. Thank you for your flexibility. The next week we'll try it with the cameras on again.
Okay. Baby steps.
Yes.
Yep. Okay, 2 more questions. Sure. So this one says, my child is starting high school this year. He was an introvert before all of this, and so already had zero interest trying to connect with any kids outside our house. He hangs out with us, his siblings. He's sweet and helpful, but he doesn't reach out to a single child from school. Is this okay? Should I push him to socialize even if he has no interest? He wasn't one to reach out before. Is this just who he is? Is it okay?
Don't push him. This is just who he is. He's introverted at this point. All of our kids are Zoomers, right? They're all iGen, and it's different than the generation we were in. So, for parents, we are probably Gen X or maybe millennial, and it's different. Your Gen X is especially very focused on as much independence as possible. Please let me get out of here. Your millennial also is like, but I want to do, my thing. I want to have my independence. Your Zoomers are different. Your Zoomers are like, no, I don't need my driver's license. Can you just drive me until I'm 19? No, I don't want. And this isn't going to help. Let's be clear. Like COVID-19 is just going to make them go, yeah, no. See, I'm aware like things can be dangerous. This is not an adventurous group in general. I'm sure all of you have like differing things, but in general, they're a much more tame group. So as an introvert, they're not wanting to connect. So I'm looking at the time. There's other things. I don't know what other interests your child has. Your child may be more interested in online connection. So, and we're going to talk safety. So not just randomly, I'm talking like an online class where there's an actual adult observing. So like outschool.com has a lot of those. Like one of my kids is basically in like an older teen group for Animal Crossing on Switch, right? So then everybody logs in and then they like trade stuff or they go to different islands and it's all older teens. They're not making best friends and connection, but it's at least some social contact, right? So some of it is to really then be creative and be like, hey, there's these things. Maybe he really likes drawing. Maybe he likes drawing anime. So instead, he's in an anime class where you can tell that there's other teenagers in the class. They're not necessarily interacting, but there's like, oh, look, there's other people in a fun social environment, and they're all drawing something. So the really outside the box, but overall, don't push. Don't push. That's just who your child is. You had
Okay.
another one.
I did. So kind of, I'm aware of time and I want to be respectful of that. So kind of a closing question. You
Okay.
have given us amazing action items, right? And if they are all different or feel like a stretch or feel like, you know what, we've got so much going on, I cannot do 8 things at once, where would you recommend beginning? Where could we, what could be the pivot point to make the most positive impact?
Your 4 core is always going to be, so it's sleep, hygiene, exercise, food. That's it. All right. Start with your 4 core, because if those are out, you're not making much progress. Obviously, be connected with your kids, be kind with your kids, lower expectations. But in terms of a routine, sleep, eating, exercise, hygiene, those are your 4. Start there. Make sure those are doing pretty well, and then you can always add on as needed.
Okay, that's a good place to ground.
Yes.
Dr. Sager, thank you so much for spending your time with us today and sharing your wisdom. I think it has really given all the families some action items, things to be able to do. Folks, I want to let you know that next week we will be having a guest speaker who's going to talk about socialization and some tips about how it's changing, how to help with some particular red flags may be. So stay tuned for that information. I want to thank Amanda Pezzett and Michelle Snyder-Smith, co-admins who have been behind the scenes working. And again, thank you, Dr. Sager, for sharing your expertise with us. So thanks, everybody. Have a wonderful night. Bye.